Good morning, everyone. And just in terms of a brief introduction, my name is Asim Amin, and I direct the immunotherapy program at the Levine Cancer Institute. For those who are not familiar with us, we are in both the Carolinas. The Levine Cancer Institute is part of Atrium Health that has 21 locations across both the Carolinas. And the premise here is to try and get excellent care to folks close to home rather than folks trying to travel to one location. I'm thankful for Sam and the Gill family for their contribution and collaboration with the Levine Cancer Institute in getting this program together, and the supportive oncology group out here with Declan Walsh and his team, because that is the theme for today's meeting. So with that, let me just, I hope you can see my slides. So if you can, then let me just kind of very briefly introduce where we are in melanoma and what used to be. So the numbers as per the American Cancer Society for this year are about 100,000 new diagnoses and about close to 6,800 deaths. Now, what is interesting is if you look at what has been happening to the incidence of melanoma over the last 5 years, this is the curve that is generated if you put in the numbers from the American Cancer Society. So the incidence has been steadily going up. But what is very heartening is this: the number of deaths has actually declined over the last 5 years. And yes, this is partly due to early diagnosis, but this also has to do with the therapeutic advances that have been extremely exciting and rapid in this disease site. So just to kind of share with you how the drug development has happened in melanoma, melanoma has been a poster child, and in fact, developments that happened here have now spilled over into the entire oncology world. So this is for those who treated melanoma way back, who don't have hair or have very gray hair. These were the only options that were there. And for the longest time, nothing worked. Interleukin-2 and dacarbazine chemotherapy was there. And then by 2011, suddenly there were a whole bunch of new options that started coming around. So ipilimumab, vemurafenib, dabrafenib, trametinib, and then the anti-PD-1 inhibitors, the combinations, the vaccines, in the adjuvant setting where there was completely resected disease, many options grew. And this has continued over the last 5 years. In fact, the rate of evolution has been so rapid that options that were approved as recently as 2015 are already outdated. So, this is just to kind of give you a sense of how things have developed. Now, the interesting thing is that it is not only the options or number of options that have developed, it is also the outcomes. So on this graph, the x-axis is time in months. So this is the 5-year mark, and this is overall survival on the y-axis. You can see this dark blue line at the bottom. This used to be the overall survival for stage 4 melanomas. So while there were some folks who made it to the 10-year mark, to the 5-year mark, the numbers were very modest, 5 to 10%. The curves above that, you see, especially looking at this green curve up here, is the curve that was generated after 5 years of follow-up with folks who were treated with combination immunotherapy using nivolumab plus ipilimumab. So the 50% survival is right here. So median survival has actually not been reached at 5 years. So the improvement in overall survival is shown by this red arrow. So higher the curves, more people alive. Farther out the curves, more people alive. So that's has been a very major impact in the outcomes. Not only that, but if you look at those folks who were treated with immunotherapy uh, and had a response, 74% of those have not required any further treatment, as shown in this pie chart. In the maroon, you see all these folks who have not required any subsequent treatment after initial treatment with immunotherapy. So they, in a sense, they have been cured. We use the word carefully, but yes, we are optimistic in that. The Nobel Prize for Medicine last year went to Jim Allison and Tasuku Honjo for development and discovery of immunotherapy. So I would be amiss if I did not show you their picture. Now, there are, in all the options that I showed you, there was immunotherapy and there was also targeted therapy against BRAF mutations. And these are the survival curves, the 5-year survival curves for the BRAF and MEK inhibition that is targeted therapy. This is the 5-year mark. This is, again, the historical, the blue, dark blue curve is the historical survival. And this is the increment that we've seen with the 5-year survival with targeted therapy. And these responses can be quite dramatic and significant that we never ever used to see before. This is a neglected, rapidly progressive melanoma on the left that after 3 months of treatment had complete response. So we never ever saw this, and that is what is being exciting for us in the melanoma community. One of the problems that has plagued all malignancies, but especially melanoma, has been brain metastasis. Involvement of brain is to have a very dismal outcome with the median survival shown here with this red dot. So this is time in months. So this is 3-month mark, and this is the overall survival on the y-axis. So the median survival used to be about 2 to 5 months, shown here. And with both the targeted therapy as well as dual immunotherapy, curves like what we see on the top have now been generated. So at the 1-year mark, there's 80% of the individuals who are alive and doing well. This follow-up is still pretty short, so we'll have to see how this pans out. But again, major improvements. So, I don't know if you recognize that the median survival for breast cancer that is metastasized is about 3 years. And we've done a lot of work with folks who are survivors after dealing with breast cancer. The median survival out here with dual immunotherapy in some situations is not yet been reached at 5 years. So while the number of patients with melanoma are not as many as breast cancer, there are folks who are surviving longer and doing well. And therefore, when the idea of this meeting was discussed initially with Sam, Guild and all, we were very excited because we do have to do a lot of work in managing the survivorship in melanoma that used to be a non-existent entity.